So diseases of the nervous system. So chapter 24, but I just want to make sure that that's right. 22. No, it's not right. That's not the right chapter number. I'm sorry, guys. So this is 24 in the old textbook, but in this new edition, it's chapter 25. Okay, so let me try to, hold on, let me fix this. So it's chapter 25. Okay, so important things to remember. So I have a picture of the meninges on here. So the meninges are the covering of the brain and the spinal cord. So they're important, kind of like the wrapper around the brain. So that's going to keep your brain protected from bacteria, viruses, drugs, anything that's in your body that's bad. Okay, so basic anatomy review. So the central nervous system is made up of the brain and the spinal cord. And the peripheral nervous system is everything else, everything that's coming from the brain and the spinal cord outside of it. Okay, the blood-brain barrier is the wall or the protection that protects the brain from what's in the blood. Okay, so the capillaries have a thick wall and they don't have any spaces in between the cells. And the idea is nothing can get from your bloodstream into the brain. However, there are some points where the two come in contact. Okay, so if we start with bacterial diseases of the brain and meninges, we're going to start with meningitis. Okay, so meningitis is, there's bacterial and they're viral. So we're going to talk about bacterial first. So depending on how old you are, you can relate what bacterial infection you get. Okay, so the symptoms of meningitis are a headache, fever, chills, a stiff neck. Okay, so if with the fever comes lethargy, okay, it can lead to tissue death in the brain. It can lead to edema in the brain, and it can lead to shock. Okay, so death can occur really fast if it's not treated. So it can occur within hours. It can be preceded by an ear infection, something with the mastoid bone, respiratory infection, and it could also be followed by trauma, so where the blood-brain barrier might be damaged, or it could be brain surgery. Okay, so what they do to test for it is they'll do a spinal tap, or a lumbar puncture is another name for it. So what they're going to do is they're going to go into this between the vertebrae, and they're going to remove cerebral spinal fluid. Okay, so then they're going to take the cerebral spinal fluid, they'll gram stain it, but they're going to look for different, whether there's bacteria there or not. They're going to do blood cell count. They're going to look for glucose or protein in there, and then they can do antibody tests. They can do more molecular or an ELISA or something to also look for what's in there. Okay, so there's 3 types. I thought I made a new slide and put in here. I wonder what I did with it. Okay, so 3 that introduced this. I wonder, oh well, I guess I didn't put that file up. Okay, so there's 3 types of bacterial meningitis. Okay, so the first one that we'll talk about is meningococcal meningitis. This is one you see commercials and advertisements for because it's very contagious. Okay, so it's caused by the organism Neisseria meningitidis. It's an aerobic gram-negative. It's found in your nose and throat normally. 10% of the population carries it. It does have a capsule around it, and that capsule makes it sticky and pathogenic. Okay, it has different serotypes. So in the United States, we have this one serotype, which is called group C. And because it's gram-negative, okay, it can release the endotoxin when the organism starts to die. It has very distinguishing symptoms. So a petechial rash, okay, and it leads to like this purple purpuric rash. Okay, so distinguishing symptoms are the rash, throat infection, and the problem is you don't want anybody to go septic from it. Okay, so when it gets septic, that's when bad things happen. Okay, so Neisseria, the epidemiology is it causes problems in children under 2. Okay, so it starts in the nasopharynx and then it goes to the blood and it goes through the meninges. Okay, so my PowerPoint's all formatted. The formatting is messed up. Okay, so in the United States in 2010, there were 739 cases. What happens is they get sporadic outbreaks. So it can be found in dorms, barracks, where people are in close proximity to each other. It can also be found in prisons. It can be found in daycare centers, and could be so young adults, and children. Okay, if it is not treated, the mortality is 85%. Okay, so within 48 to 24 hours, 24 to 48 hours, it can cause death if it's not treated. Okay, the serotype C produces more endotoxin, 100 to 1,000 times more endotoxin than other bacteria. Okay, so it can be spread by aerosols, fomites. They vaccinate for it now. Okay, so when kids go away to college to stay in the dorm, they get vaccinated for meningococcal meningitis. Okay, or if you go into the army, or you're going to stay in a barracks or dorm. Okay, penicillin and cephalosporins, if they think you've been exposed to it, like your roommate has it or a suite mate has it, they're going to go ahead and treat you prophylactically. Okay, so antibiotics work. Okay, so after the antibiotics are administered, okay, what it gets induced is called the Schwartzman phenomena. So they get severe endotoxic shock, okay, because you're taking the little bacteria and you're breaking them down and they're releasing their endotoxin. Okay, so the endotoxin is gonna cause all the things that we've talked about, right? So also form blood clots and then the tissue will die. Okay, so here's a picture. Okay, so Waterhouse Friderichsen syndrome. Okay, it causes hemorrhagic adrenalitis. So you get this purple rash, widespread purpura. Okay, so you get the bacterial infection is bad. People go into shock and low blood pressure. But at that point, they'll amputate the limbs, okay, if the tissue starts to die, and they're just happy that you're alive, okay, because you're survived. Okay, now another type of bacterial meningitis is Hib, so Haemophilus influenza type B. And you probably have, if you have kids, you've heard of the Hib vaccine. Okay, so it's a gram-negative rod, pleomorphic, it's hard to grow. Epidemiology, it's found in children under 4, normal flora, most kids carry it. It does have a capsule, and when they see it, it follows the ear infection. Okay, so symptoms are fever, chills, nausea, light hurts your eyes. Okay, so headache, stiff neck is found in all of these. Okay, it's really uncommon in adults. Okay, so it can cause blindness, deafness, mental retardation. Treatment, the vaccine, so you vaccinate. Without treatment, it's fatal. Okay, with treatment, 33% of the population still dies, or people that have it still dies, and it's treated with cephalosporins. Okay, now the next one is Streptococcus pneumonia. Okay, so this is pneumococcal meningitis. So it's gram-positive. Okay, it's got a capsule. Okay, so it's all sticky, and it's a diplococci. It's alpha hemolytic, so it's got these real thick, sticky green colonies. Okay, it is normal flora, so you find it in your nose and throat. Okay, epidemiology, it's transmitted through aerosols or sharing fomites with an infected person. Okay, symptoms, chest pain, chills, cough, fever, headache, lights hurt your eyes. All the meningitis have a stiff neck. Okay, that pain. Lots of times they're drowsy, confused, very lethargic. Okay, and the treatment is a cephalosporin. Okay, so here's a picture of an autopsy, and it's kind of maybe hard to see, but these green spaces are where, so here's the meninges, here's a brain, right? They've taken off the skull cap, and in here, there are green pus covering the brain. These red things are hemorrhagic foci, okay, so places where you hemorrhaged. There's edema in there. Okay, now another type, and so I really should say that there are 4 kinds of bacterial meningitis. Okay, so this is the 4th one. Okay, and this is only found, it goes from mom to newborn. So it's group B, neonatal meningitis. So what they do is before you give birth, they do a vaginal swab and they look for this organism. If the mom has this organism, okay, 3rd trimester, the mom has this organism, what they're going to do is they're just going to give her some penicillin and try to get rid of it. They'll get rid of it. If they don't get the antibiotics in the mom before she gives birth, and it turns out that she has this, they're going to go ahead and prophylactically treat the baby. Okay, so the symptoms, okay, is that the baby might be lethargic, it's limp, kind of like a soft fever, not super high fever. Okay, so they usually check if you're having the baby in a hospital or with a healthcare provider, they're gonna screen for this before you give birth. Okay, now this is this isn't meningitis. Okay, so this is just another neurological bacterial disease. Okay, so not meningitis, neurological bacterial. Okay, and it's tetanus. Okay, so you guys know about tetanus shots. So tetanus is caused by the organism Clostridium tetani. Okay, so it's a gram-positive spore-forming rod. It's an obligate anaerobe. So what does that mean if it's an anaerobe? Okay, so it doesn't like oxygen. Okay, so epidemiology. So it's found in soil with manure. Okay, so cattle, horses, it's in the dirt, it's everywhere. Okay, it is a spore former, right? So form spores. The spores are very resistant to drying, disinfectants, heat. Okay, so the reason that we worry about tetanus is if you think about it when they say, do you need a tetanus shot? Okay, so it's usually a dirty wound. So you cut yourself, you step on a nail, you step on something that's in the dirt, okay, and it goes kind of deep. It's a puncture wound. Okay, if this organism gets in there and starts growing, okay, it will produce a toxin, okay, and the toxin causes the muscles to contract and not relax, which is what tetany is. Okay, they won't relax. So this is an extreme case of tetany. Okay, so everything is locked up, back is curved off the floor. Okay, so it causes muscle stiffness, spasms, lockjaw is what you hear. And then the part that will kill you is respiratory. Okay, so it usually is 1 to 10 days of incubation time. You have to have, okay, so we vaccinate for it. Okay, so we do DTaP. So this is diphtheria, tetanus, and pertussis. Okay, the A means whether it's attenuated or not. Okay, so tetanus, the vaccine is actually made to the toxin. Okay, so it's not to the organism, it's to the toxin that it produces. Okay, so you have to get it boosted. Okay, so they say like 8 to 10 years. If you go and you look at how many cases there are nowadays, okay, what you're going to find is people over 50 account for most of the cases, and it's because they're not boosted. Okay, botulism is another neurological disease caused by bacteria. It's caused by the organism Clostridium botulinum. Okay, so it's an obligate anaerobe. Okay, it's a gram-positive rod, forms spores. Okay, the spores are resistant to getting rid of them. Okay, they produce botulism toxin. Okay, so botulism toxin is like the most powerful toxin known to man. Okay, so if you get it from food, okay, you can get it from, there's infant botulism, and then there's wound botulism where you get the organism in a wound. Okay, so botulism is usually considered like a food poisoning. Okay, so the people have fever. Well, this says afebrile, right? No fever, sorry. It can be nauseous, don't feel good. Botulism paralyzes the your muscles. So it's going to affect the interface between the neurons and the muscle cells. Okay. They'll have a hard time speaking. It's not very common because we have good ways of preserving food. Okay, but it could be found in sausage. Okay, so the treatment that they're going to give is they're going to give an antitoxin. Okay, so botulism toxin is the same as Botox, right? So we've taken this really nasty toxin and we've kind of messed with it and are trying to use it for good. Okay, infant botulism. Infant botulism is the reason that they say when babies are little not to give them honey or spinach or things that might not be, might have bacteria on them. Okay, so the organism will grow in the baby's intestines and it doesn't take that many bacteria to cause symptoms. And they say it's a floppy baby. Okay, so they don't have any control over their neurons or their muscles. Their neurons don't have any control over their muscles. Okay, now if we get to viral diseases. Okay, so viral diseases, first thing I have on here is viral meningitis. Viral meningitis is not as bad as bacterial meningitis, but it still is very scary because they have the same symptoms. Rabies is a viral disease, okay? So it affects the nervous system. Okay, so the rabies is going to be transferred with saliva, urine, and feces from the infected animal. Okay, so the reservoir could be a wild animal like a fox or raccoon, and it goes then into the domestic animals, and we touch the domestic animals. If they're not been vaccinated, it can be transmitted. Okay, so it goes to the spinal cord, the brain, and the nerves. Okay, the symptoms are or like, well, foaming. They're afraid of the foaming at the mouth if it's an animal. Um, they're confused. They're not actually acting right because it's affecting the nervous system. It actually makes them afraid of water. Okay, so prevention and treatment. So the way that we prevent it is we prevent it with vaccines. So we vaccinate the animals. Okay, but if you get exposed, then they'll give you a shots, which it's going to be a vaccine that they're giving you. Okay, so according to this graph, cats are more likely to transmit it, like a feral cat or a cat that's outside and hasn't been vaccinated. A cat that's outside is more likely to transmit it than a dog. Okay, the next thing I have on here is listeriosis. Okay, so this is another bacterial disease. Okay, so Listeria monocytogenes. It's a gram-positive rod. Okay, so it's found in food. So it's found in vegetables, milk, cheese, meat, and sometimes you'll see things where there's a recall on something that's in the grocery store because they find Listeria in it. So they're screening for it. Okay, it's a problem in older adults, pregnant women, newborns, or anyone with a weakened immune system. It can cause fever, muscle aches, diarrhea, kind of like a stomach bug. But the problem is in pregnant women, they can have fever and it can cause miscarriage, stillbirth, okay, premature delivery, or an infection of the newborn. Okay, so I have the link to the CDC website about how to cook food and how to prevent listeria. Another viral disease of the nervous system is polio. Okay, so poliomyelitis. Okay, so it's viral. The disease, it damages, and we talked about this in the virus chapter. Okay, so what happens is it damages the nervous system so you can't control the muscles. Okay, we prevent it by vaccinating. This is a picture with the iron lung. Okay, so this was what they would do to help people breathe if their diaphragm wasn't working anymore because of polio. And I think that's a pretty good summary.